like this into an anterior half and a posterior half, and you're visualizing the cavity of the rectum and the anal canal. I won't touch much on the rectum. It will more the anal canal that we will make an assessment at this point in time. Is that okay? But when you make a section, this is how it will be. This will be the skin. This will be the perineal, the gluteal region. This exactly will represent the aperture, and from above downwards, from below upwards, we are ascending up. Is that okay? The whole anal, come off this side. I will be blocking you. Now, at the anal aperture, if you feel, all of us would have felt it when we were trying to clean or after defecation. It is not a smooth skin, it is a corrugated skin. It is not smooth, it has got some irregularities at the site of anal aperture, which is somewhere at this junction, for example. This is the site of anal aperture, point number one. Second thing that you would have felt in that particular area was hair follicles or long lengthy hairs or hairs in that particular region. Number three, that area is kept always moist because of various glandular structures that are there. Now, the skin that lines the gluteal region or the perineum also lines the anal aperture, plus to a segment up to this area or the first segment, meaning what I'm trying to say is the skin continues into the segment of the anal canal to one particular region, after which it disappears. So this particular fragment of the skin which continues into the anal canal cavity to begin with is cutaneous section. Guys, are we okay? Cutaneous. Are we okay? Now, since it is cutaneous, it should be lined by stratified squamous epithelium. Embryologically, it should have developed from the ectoderm, and there are some sebaceous glands and sweat glands like the skin plus the hair follicle. That is why there is a hair follicle. Are we okay? Now, the next segment after this is the cutaneous part. This part, what happens here is the epithelial, let me begin from the epithelial lining. Epithelial lining of the GIT is predominantly tall columnar cells. But the lowermost segment of your GIT is stratified squamous epithelium because there is skin. This next segment here has an epithelium which is neither columnar nor stratified squamous. It is kind of a transitional zone. It does not have the hyperpigmented skin like in this region here. It is more of mucus lining, mucosa lining plus the skin lining. They call it as mucocutaneous section. Mucocutaneous section. It is neither the mucosa completely nor the skin completely. It is somewhere in between, and the epithelium can be either squamous epithelium or a mixture of, it is not a squamous, it is not a columnar, somewhere in between. That's what you need to understand. Is that okay? That is the middle segment of it. Are we okay? There you don't have any other feature. It is, some of it gets developed from the ectoderm, some gets developed from the endoderm. So that is the second part of the zone that you're talking about, which is from one area, from this area to the other area, is the second one. I'm not sure whether they are called as transitional zone. You can always call that as a transitional zone as well, but go back and cross check. I'll just write that, but I'm going to put a question mark there for you to look at it. Transitional. Is that okay? But go back and check. That is this area, second area. Are we okay? Now we are going to the third most region, which is above. From this line and above is all developed from the endoderm. From this line and above, epithelial lining is tall columnar epithelium, number 2. But when you look at the content of this particular area, which will be something like columns of cells, columns of mucosal folds with a gap in between. Again, I repeat, it is smooth here, but it is not considered smooth because you have a hair follicle there. Here it is absolutely smooth, but in this area, the mucosa is not flat. Instead, it has got certain columns, which means if this is one column, this is another column, this is another column, it will be like a mucosal fold, something like you take and it gets folded. there is a gap between one fold and another fold. Hold on. One fold here, another fold here, there is a gap. So mucosal fold, in between there is a gap. In between there is a gap. Is that okay? Now, I want you to come in a circle. You three, all of you can come in a circle. And this is how the columns look like. You record for me, ma. You stay outside and you record. I want you to come a little closer. I want you to kind of open your legs like this. Touch the tip of a leg. That is what it is. We are the uppermost part of the column. This segment where the feet is the lowermost part of the column. Are we okay? Uppermost part of the column beyond which continues the rectum. The lowermost part of the column beyond which continues with the transitional zone. Are we okay? Now, we are called as anal columns. In between the anal column and column there is a gap which is called as anal crypts. These lower segment of the anal columns which are joined together is called as an anal valve, behind which there is a small area called as anal sinus which is a kind of an opening wherein which the secretions that fall into the crypts goes through the sinus and smears the rest of the region. Are we okay? So, in the third segment, you have certain things. It is not a smooth area. Instead, it has got few folds of mucosal membrane. In between the few folds of mucosal membrane is the anal crypt. And the lower segment of the anal column is all united, which is a kind of a ring in that particular area. Plus, these valves, the lower segment of the columns that unite is called as a valve. Behind the valve is an opening. Guys, are we okay? Do you understand? In the crypts, the glands related to the anal canal open. Whatever secretions that are formed in the crypts passes through the sinus, smears the rest of the region. Guys, are we okay? Do you understand? Is that okay? Clear? So, you have numerous columns in this area. Numerous columns in this area. Guys, are we okay? Fine. This segment which joins, which forms like a kind of all the lower segment of the column which unites, creating a demarcation between the second segment and the third segment. This line is called as pectinate line. Guys, are we okay? Pectinate line. This line is called as white line of Hilton. Are we okay? So, these structures, fold of mucosal membranes, are called as anal columns. The gap between the columns are called as anal crypts. The lower segment of the column unites between one column and another column by means of that mucosal fold, forming a valve. Behind the valve there is a small opening called sinus, through which whatever secretions that are formed in the crypts passes through the sinus to smear the second and the third segment. Guys, are we okay? Are we okay? Any questions on this? Now I am coming to the second segment of it, which is blood vessels and the sphincters you need to know. Second, let me finish the sphincters first. Now, defecation in general, all of us have the urge to pass motion when feces gets accumulated in your rectum. The rectum, when it has the feces, it dilates, and then because of the pressure, you have the urge to pass motion. Are we okay? But when the feces comes into the anal canal, it is no more under your control. You should be on the potty. Is that okay? That is the first point. Now, for sometimes as we are defecating, we kind of want to stop defecating. All we do is we kind of hold the sphincters tight enough or constrict the sphincters tight enough where in which the motion that passes through can be cut off. Yes or no? So which means what? Certain portion of your defecation is not under your control. Certain part of it is under your control because of the sphincters that comes into the picture. There are two types of sphincters. One sphincter, which is basically, if you look at the linings of the mucosal folds, if you look at it, it is from the mucosa to the periphery. If you look at the histological component, they said mucosa, submucosa, muscularis layer, inner longitudinal, outer longitudinal muscles, followed by the serosa. Is that okay? The inner longitudinal, outer circular, inner circular, outer longitudinal muscle, which we need to be worried about. This inner circular muscle, which continues all along to the region of the rectum, between the anorectal junction, beyond which what does it do is, inner circular continues downwards like this, all along the length of the anal canal, and this segment is called as internal anal sphincter. Guys, are we okay? Inner circular layer, lengthwise, all along it continues downwards, all along the length of the anal canal to form the internal anal sphincter. It is a smooth muscle, it is not under your control. It is a smooth muscle, not under your control. Point number one. If there is something internal anal sphincter, there should be something called as external anal sphincters. External anal sphincters are 3 blocks of skeletal muscles. That is when you sit on the potty and you want to defecate, suddenly your phone rings, you want to grab the phone, what do? As you're passing motion, you're not running, you just want to squeeze the whole thing up, which is voluntary. You stop defecating, then you grab what you have to do, and then you continue to do what you do. Are we okay? Now that happens, isn't it? It is under your control, correct or wrong? All of us would have done that. That is basically done by the external anal sphincter, which is basically a skeletal muscle. It is located, it is got 3 blocks of muscles, okay? One just underneath the skin, like this, at the level of involving the first segment. Are we okay? Second, it is somewhere in this area involving the second one. The third one is like this, involving the third area. Is that okay? This block of skeletal muscle, that kind of controls or kind of placed laterally, not as far as this, which would be very much closer to this as well, is what is called as external anal sphincters. Guys, are we okay? Do you understand?
Yes.
Okay. So, external anal sphincters, 3 segments, isn't it? Which is called as, this one is just below the skin, so it is called as superficial external anal sphincter. This is above, so they call it as superior external anal sphincter. This is very much deep, so this is called as deep external anal sphincter. Depending upon the location, 3 blocks of external skeletal muscles in relation to the 3 segments of the anal canal are placed, and they are skeletal muscle which is not under your control, which is under your control. Are we okay, guys? Do you understand? So just below the skin, in corresponding to the first segment, is superficial anal sphincter. Are we okay with that? Much higher is superior anal sphincter, which is very much just lateral to the internal sphincter. Just lateral to this is deep anal sphincter. I put it a little further. I don't want to smudge what I have written there. Are we okay, everybody? It is not that far. It is absolutely close. Are we okay, guys? Fine, everybody? Sphincters, are we okay? No issues with that? Correct? Last point, blood vessels. There are arteries and veins that follows this. Arteries, arteries that supply, each segment has its own artery. The one that takes care of this segment is basically superior rectal artery. This segment, middle rectal artery. This segment, any idea? Sorry? Inferior rectal artery. That's all. Is that okay? Now veins follow the artery. So they are called as vein, 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 in corresponding to 3 segments. Are we okay? Now, why is it significant? If you remember portocaval anastomosis, In and around the anal canal, there is also systemic circulation, and the portal veins merge or kind of anastomose. If somebody has got a portal hypertension, certain regions where these connections between the portal system and the systemic system dilates. Are we okay? Now, when this segment and this segment are the ones that kind of, they are all part and parcel of portocaval anastomosis. Now, what will happen when there is portal hypertension in the liver? There are certain regions in your body, the blood vessels that anastomose between the systemic circulation and the portal circulation, they dilate. When it dilates, in this segment, relation to the artery, in relation to the portocaval veins here, in relation to the veins in this region, you tend to feel like a bag of noodles or a wormy pattern of flat pattern that can be felt in that region or in this segment. Is that okay? If it is felt here, bag of worms or a dilated blood vessels which is covered by a mucosal membrane, when you insert the finger, it is called external hemorrhoids. If you push the finger further up, and when you reach the third segment and you have a mucosal fold, along with the mucosal fold, you feel another bag of worms in that particular area, which is nothing but the dilated blood vessels in that area. They are called as internal hemorrhoids. Are we okay? Fine, everyone? Now, when you insert the finger, it should be continuous. Suppose there is a crack of tissue or the mucosal membrane kind of, there is a cut and it opens up, which is called as a fissure. Alright, if there is a hole there, wherein which, suppose there is a small hole and internally it is connected to an abscess or something else, and there is a small canal from the source up to this hole that opens into the mucous membrane, which is called as sinus. So there are multiple things that you will have to make an assessment. So suppose, for example, if you have an anal canal, something like this, and there is a small hole that you feel in this area, and this is a cavity that is generating a pus, which is linked by this tubular structure. Whatever pus that is secreted passes through this particular tubular structure canal, and then it opens into the mucosa by the aperture into the cavity. So when you insert, you will feel a small punctured hole in that particular site, which can be on the perineal region or which can be within the mucosal lining of the anal canal. Are we okay, guys? So there are some terms that you need to understand. Go back and read through it. Anal fissure, laws of continuation of mucosal lining or a crack in that lining. Suppose if I take a knife and I cut, you have the skin that opens, same thing, mucosal lining within the anal canal happens, fissure. Anal sinus, which is nothing but a small punctured hole there in which a canal is connected, or a tubular connection between the source from which there can be pus or anything that can pass through and come out through this sinus. That is another thing that you need to be mindful of. Next, external hemorrhoids. Here, internal hemorrhoids. Are we okay? Next, what happens is either in this area here or here, wherever, the mucosal fold, something happens to it, a small mucosal fold kind of a projection like this will come, and it could be a polyp, mucosal polyp, something like a skin tag which you would have seen in your grandparents, something like a small projection from the skin which comes out like a round ball or a beaded like structure. That can be a polyp. In any of these regions you can find a polyp as well. So polyp is the next one. Are we okay, guys? Fine, everyone?